I know. Hey, my good buddy Rob Mattacchione, who I'm so glad I met, and he's going to be with us still talking about Novo Integrated for some time because I just can't get enough of how he really opened our eyes to this decentralized healthcare and talk about a company who was the right place at the right time. Novo Integrated is the name of the company. They are publicly traded. They uplisted, Rusty, from an OTC QB bulletin board company up to NASDAQ NVOS. That's a big move for a small company.
I hear you just check a box and
you don't
let
just
you
check.
in. Isn't that
they
like
don't.
simple thing?
How hard was that, Rob? Rob, I mean, honestly, from the very first time when you said, I'm going to uplist this company, like what? It was like years, months, minutes.
Yeah, it was months. It was
Wow.
the better part of a year. And, we had to do a bunch of things leading up to that to put us in a position where we could even contemplate it. So it was 2 years of building, 1 year of prepping, probably 6 months between applications and everything else. But, it was well worth it, and we're good to be there.
That's good to know because every company in that theater then has to have gone through quite the regiment.
Yeah, right. Well, I think the other piece of this thing though is what is interesting to me is that not just the uplisting of the company, but the fact that where you guys were a year ago. Take us back, Rob, to where Novo Integrated was in, let's say, February, the end of February 2020, right before the pandemic. What trajectory were you on, and what happened?
It's funny story. At that time, you have your projections as a company, both public and private, and we were looking for 10, 15% growth, trying to really get the message across of the importance of telehealth and just medical technology in general for traditional wellness and healthcare businesses. And along came COVID, and it just accelerated everything. Revenues, we're starting to feel the effects of what that is in terms of the importance of the new technologies, but it's really the messaging. It's really the acceptance. Russ said it some time ago that the adoption went through the roof. And that's really what we experienced, an incredible adoption rate, both from our patients and our practitioners. And the real desire to solve a problem turned out to be more than just, let's say, solving a problem that was as a result of the pandemic, but really became just a general solution.
Yeah, and I think part of this thing is thinking in terms of when you have to pivot as a publicly traded company because of business reasons, that's one thing. But when you don't know what the future brings, like last year, that must have been difficult. But then again, at the same time, you guys saw an opportunity because it played into your business model, correct?
Yeah, it did play right into the model, and really we didn't do anything different. We just got acceptance for what we were doing. And I'll tell you, a funny story. Just last week and a half ago, I went for my vaccine, and I had an adverse reaction.
Oh boy!
Which again,
I have to tell you, I talked to Rob. I couldn't get a hold of Rob for a couple of days.
And that was.
I was actually worried. It was exactly what I thought. You got your butt kicked, man.
Oh, what?
Oh, it was worse than that. At least the butt kicking, you can stand up after.
Oh.
So continue your story. Yeah. This is interesting.
It was tough, right? And really, what helped me through it and what continues to be the post solution, so to speak, is the products. The emphasis on immune-based products, things that strengthen your immune system. And if we didn't have to take the vaccine because we were already in a better place from an immune perspective, then I wouldn't have had to experience that. But what I did see and realize that no one, not me, not anyone, is protected from what can come, both from the actual virus and the solutions being presented for the virus.
I think the moral of that story is that the pandemic highlighted your business model, Rob. I mean, I think that's exactly what happened. Not to say that you weren't going to be successful without it, but it really did highlight that business model of yours.
Yeah, 100%. It's it highlighted it. It also showed the necessity of it.
Yeah, right. No question.
Right. But we need solutions, and we have to evolve into new solutions. But really, this is the the holy grail of healthcare for tomorrow. It's technology.
Hey, Rob, let me ask you real quick before you get out of here. You talk about solutions. What about product solutions for preventative healthcare? That's right. That's the next frontier for you.
Yeah, Sully, I'm telling you that's really what I was referencing when I said about the post-vaccine stuff. I'm on certain products that are inherent to us, proprietary to us as through Novo, that are helping me through the recovery of that adverse reaction. it's amazing. The products are going to take us to the next level where hopefully we won't even need too much in the way of the technology to deal with services.
Yeah, and I think what's interesting is because you're talking about non-reactive, because there's reactive healthcare.
Right.
Russ breaks something.
Go to the doctor.
Go to the doctor. But
Get
this
to
is
put this
preventative.
back, yeah.
Rob, it's time for you to get to San Diego, pal. There's no more excuses. COVID's over. You run a biopharma company, and it's sunny here. Get your butt down here.
Iron the Speedo.
And we
Pack
do
it.
Get packing. Rob Mattacchione, he's the CEO and board chairman of a company called Novo Integrated. I'm so happy he's a member of this cast at this point. NVOS is their stock symbol.
Nah.
And they are novointegrated.com. So there you go.